right, hello everyone. Thanks for joining today. We're just going to give it a couple more minutes to let other people join today's session, and then we will get started. And for those of you who just joined, thanks for joining us tonight. We're just giving it a couple more minutes, and then we will get started with today's webinar. I think we probably could get started at this point. It looks like most of you have joined. So thanks for joining today's webinar, everyone. We're here to talk with you about our post-baccalaureate nursing program that we offer here at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Castle. I work in the admission office here, and here with me, I have a couple of my colleagues, and I will turn it over to them to introduce themselves. So I'll start with Christian.
Hi, everyone. Thank you for joining. My name is Christian. I work at the Worcester campus for MCPHS, and I work directly with the nursing programs, and I'm here in admissions. So feel free to reach out anytime if you do have any questions. Thank you again.
Right, and Ro, I'll turn it over to you.
Hi everyone, I'm Ro. I peeked over at the participants and I recognized some of the names. So hello. I work over at the Boston campus with the nursing programs. I'm a transfer counselor, and I'm always a resource. So feel free to reach out to me anytime.
Perfect. And last but not least, Amy, our wonderful student.
Hello, my name is Amy Dion. I'm in the post-baccalaureate program on the Manchester campus, and I'm in my fourth and last semester. So happy to answer any of your questions and share some of my experiences.
Awesome. So that's a little background about who we are. We can't see or hear you at all during this presentation. So if you do have any questions while we're going through the material, there should be a little Q&A box at the corner of your screen. So feel free to leave any questions there, and we'll make sure to address those towards the end of the presentation. Another thing to note is that this presentation will be recorded. So if at any time you need to step out, feel free, and we can always send you the recording at another time. All right, so let's get started. So I'll turn it over to Ro to get it started.
All right. Well, congrats on choosing healthcare as a career, guys. It's a great field to get into right now. It's in high demand. It's rapidly expanding. As you can see here, the U.S. Bureau of Labor Statistics states that a third of all the jobs through 2026 are going to be in the healthcare industry. So it's great to get in right now, go to school, and get all of this done. Get your post-bac and become an RN. Our students are finding job placements all over the place soon after graduation. Some of them are even receiving job offers before graduation. And as future nursing applicants, you probably already know that the profession has a very strong projected job growth. The profession actually ranks among the top 30 healthcare careers, according to U.S. News and World Report. And we realized that returning to school again for another degree is a big investment of both time and money. But this program, and specifically the current job outlook and quality and education that MCPHS provides, we really believe that this is a good investment for you and your resources. All right, this is me as well. So MCPHS is a healthcare specific university. We offer 100 different programs in different fields. University has been around for a long time, currently celebrating our 200th anniversary. which is insane. What a what a long time to be around. Fun fact, oldest university in Boston. That's us. And we started as just a pharmacy program, but we've grown to incorporate over 7,500 diverse students between all of our 3 campuses, including online. And since healthcare is our specialty, many of our faculty are still working in the healthcare field while also teaching you. So they're well versed in course material and what the field is like, and they're constantly staying up to date on the current healthcare system. And so through school-sponsored events and other social activities, students here learn a lot about the different healthcare professions before entering the field. And we pride ourselves on maintaining a bunch of clinical affiliations with some of the leading medical institutions in the nation, which we're going to touch on a little bit later in the presentation. Yeah, I'll pass it off to Christian.
So here's a look at our campus locations. The Boston campus was founded in 1823. It's our largest and oldest campus. It's in the Longwood medical area, surrounded by other well-known healthcare facilities. A majority of the programs we offer on this campus are undergraduate, but we also offer a wide variety of graduate, doctoral, certificate programs here too. About 40 miles west of Boston, we have our Worcester campus. That's where I'm located. Worcester's our second largest campus, which was founded in the year 2000. Worcester is actually the second largest city in New England and one of the fastest growing hubs of innovation in the US. Here you find healthcare right here at your fingertips. For example, St. Vincent's Hospital is just steps away from our campus. UMass Memorial Medical Center, which is part of Massachusetts' largest integrative healthcare systems, is right down the street. All the programs we offer at this campus are either graduate, doctoral, or post-baccalaureate programs. University-sponsored housing is available for students at this campus in Worcester. We also have our Manchester campus. It's founded in 2002. This campus is located in downtown Manchester, New Hampshire. It's the smallest of our campuses. It's only about an hour north of Boston, and Worcester campuses are within driving distance of Concord Hospital, Dartmouth Hitchcock Medical Center, and many more. We offer post-baccalaureate, graduate, doctoral programs here at this campus. And we also offer off-campus housing, which is available to students.
All right, so MCPHS is committed to your success. So our university has a reputation that is dedicated to the success of our students with an immersive hands-on culture. Starting off with interprofessional education, also known as IPE. At least once a semester, students participate in IPE activities. They can engage with students in other programs. For example, like BSN nursing students might work with pharmacy students, vice versa. This is it's a great way for students to learn about other healthcare professions and what things are like in the field and how to work with patients from other cultures and backgrounds and kind of learn how to work as a team. And because once you get out there in the healthcare field, learning how to work as a team is one of the most important things to know. We also have a hands-on supportive faculty right down the hall from where students have classes and labs in the academic building. Our faculty have scheduled office hours, and they're often available to help students with questions that they may have throughout the day, throughout the week. And we also have resources through our Center for Academic Success and Enrichment, aka CASE. And that is there to help students who might be struggling academically. There's peer tutors and mentors available to students if they need that help. And we also offer on-site counselors for mental health emergencies and wellness, which is also really important, as well as a Center for Career Services. They can help you with resume writing, mock interviews, and just job searching in general. And other than academics, we also have options to join both nursing-specific organizations as well as other cross-programmatic clubs. So, this can be a busy program, but there's so many opportunities to get involved with so many other things like student government, campus activities, fundraisers, and drives. I could go on for hours. And I think I'm turning it over to Amy to talk about a little bit about her experience with IPE.
Sure. So I've really enjoyed IPE. I found it's a great opportunity kind of, I think sometimes, especially in this program, because it is so kind of rigorous, you get kind of siloed and this is what I'm going to school for and this is what I'm going to do. But I think IPE is really an insightful experience to be part of that collaborative team. So my IPE experience was, I think, much similar to others in other semesters as well, is you're working with, pharmacy, OT students, for example, and you're getting together and understanding each other's programs, which I think is really important, and, understanding what their program's like and what their career outcome is like. And I really saw that play out when I started in the hospital setting for my clinicals. I started working with PAs, I started working with pharmacy, and it was nice to have kind of that base understanding of their role and my role and how we work together and how it really is really a collaborative effort for patient care. I also wanted to comment briefly, I know we haven't really talked about this previously, but career services, touching on the resume, I thought was really instrumental in leading up to graduation. In our third semester, we start working on our resumes. And then the fourth semester, we really kind of tweak them and finalize them. And they were a tremendous resource. And it really set us up for success because right now I have a resume that's ready to go. And I've actually started applying and I have my first interview a week from today. And that wouldn't have been possible without career services. They came in into the classroom and talked about kind of tips and tricks for resumes. And then we actually worked with them one-on-one to develop a resume that we can actually use within our clinical practice when we graduate. So it's been a tremendous resource to really set us up for success. So I really appreciated that.
I love that. I can't wait to hear how your interview goes next week, Amy. Super exciting. All right, so we'll turn it over to the next slide to talk a little bit more about our nursing program. So at our esteemed School of Nursing here at MCPHS, we actually offer quite a few different nursing programs. So today we're here to talk to you about our post-baccalaureate nursing program that we offer. And this is a 16-month program designed for students who already hold a bachelor's degree in a field other than nursing. It's a full-time program offered across all three of our campuses. So you can either study at our Boston, Worcester, or Manchester campuses. And there's two different start dates in which you can choose to apply for. You can either choose to apply for the spring or fall start date. But besides that program, we do have a couple other nursing programs. So we also have a traditional 32-month nursing program, and that's specifically at our Boston campus. It is accelerated in nature, being that it's only 32 months long. So people often do confuse the two, of the 16-month and the 32-month, given that they're both kind of accelerated in nature. But the 32-month program is designed for first-time freshmen or transfer students. So if you yourself already hold a bachelor's degree or you're expecting to earn a bachelor's degree soon, you'd want to apply for the 16-month post-baccalaureate nursing program. And then lastly, we also have graduate nursing programs online. So if you plan to continue on in your nursing career, we do have programs here available for you. We have a family nurse practitioner master's program. We have a psychiatric mental health nurse practitioner master's program. We have graduate certificate programs, and we even have a doctor of nursing practice program too. So all those programs are offered online. It's definitely something to look forward to in your future if you wanted to. Oh, sorry, I switched slides. Okay, got it. Got the right slide. Took me a little bit. All right. So during the post-baccalaureate nursing program, our nursing students here at MCPHS have access to a wide array of resources to aid in their learning process and to prepare them for a future career as a nurse. So throughout the program, our students have access to the use of educational technology, multiple clinical experiences in a variety of different settings. They even have NCLEX preparation and the use of the state-of-the-art lab and facilities for their clinicals and lab experiences. We have simulation mannequins in our labs on all three campuses, which you'll definitely get practice with. Really, lab is supposed to be a supportive and safe learning environment for you, where you get to work with your peers and faculty in the program and practice what you learn from lecture and clinical and bridge any gaps. These are really designed to develop real life critical thinking skills and thinking quickly on your feet during complex care situations. And like I said previously, we have mannequins and they're amazing. They are just like a human being pretty much. They can do everything from talk to you to bleed. They can go into cardiac arrest, hemorrhage, and even give birth. So it's pretty cool to be able to learn on those mannequins that are so real life or lifelike, I should say. So with that being said, I am going to turn it over to Amy to share a little bit more about the simulation experience that you have during lab.
So one of the things that drew me to MCPHS was the facilities here, and a lot of that was the lab and the simulation. The lab is huge, which is really important when you're kind of waiting for your turn up in simulation. So like to Hannah's point, the mannequins do everything. You can listen to lung sounds, you can take a blood pressure. It's really interesting. And it's also, like Hannah also said, a safe place to make mistakes, ask questions, practice injections, doing all the things that you want to be comfortable with before you actually start going out and meeting and working with actual patients. As you progress in the program, in the beginning, it's more a lot of like the foundational skills. As you progress in the program, you have more simulations. So the simulations are kind of pre-coursework that you do there's a patient in a scenario that you familiarize yourself with. And then once you get in there, you take turns in groups to practice like what you would see in like a real world setting. So there's a code that's called, or a postpartum patient's experiencing a hemorrhage. So you have to kind of think quickly and make these decisions and, kind of stage these interventions. And then after, what's really helpful is you talk about it, what went well, what could have gone a little bit better. And it's really important because these are your peers. So these are people that are in the same position as you, trying to learn. And then you'll go to another simulation and it switches. So if you were the nurse before, then you're the nurse now. So it's a really good opportunity to, ask the instructors questions. We did this, but I was wondering why we did this, or could we have done that? So it's a really good opportunity to put those skills to use. I've also found that there's a lot of continuity in our didactic versus our clinical and versus our simulation experience. So the professors are really cognizant of what we're learning versus what we're doing in simulation. So for example, in my semester that I'm in now in advanced med surg, we, for example, on Monday had like a shock simulation. And then that actually really complemented the fact that we had our shock test on Wednesday. So it really kind of reinforces all those skills that you're learning in didactic and seeing into the real world to then also through your exams. It's been really helpful, and it's fun. It's something different, so it's nice.
It's definitely beneficial, and labs are also very beneficial for your clinical experiences, which now we will talk about. So in addition to your labs, you are going to complete hands-on clinical experiences, which is what everyone's favorite part is. It's kind of putting everything together. And you'll complete a variety of different clinical rotations during the program. So everything from med-surg to mental health, maternity, pediatrics, you'll have a community health, and then you'll have an advanced med-surg rotation, which is what Amy's in right now. And what's exciting about the clinical rotations is that they actually begin in your first semester of the program. So you hit the ball running right away, which is great. And they'll continue on throughout the duration of the program. So again, the program is 16 months, so it goes really fast. So 4 total semesters. So each semester you'll have clinicals during those. And the rotations take place in a variety of different settings within healthcare. So anything from, hospice settings to home health agencies, mental health hospitals, schools, school systems, and, larger name hospitals, smaller clinics. So we do try to be as fair as possible in terms of providing students with a combination of both large name hospitals and community hospitals. So it's good that you'll get opportunities in both areas. And we have a lot of different clinical sites nearby. I mean, over the 200 years that we've been around, we've been able to build those connections with local healthcare facilities. So we have, like, at this point, over 900 different clinical sites throughout New England and beyond. But it is important to note that, wherever you choose to attend, whichever campus it is, you usually will do them close by that campus. So no more than maybe like an hour's drive or less from whichever campus it is that you're attending. So I'll turn it back over to Amy. Would you be able to share a little bit more about your clinical experience? I mean, given now that you're in your fourth semester, you've gone through quite a few clinicals at this point. What's your experience been like with those?
I'm definitely happy to share because I know, a little over a year ago, I was sitting here on the other side, eagerly awaiting all the information about clinicals. So I'll share a little bit about my personal experience with clinical. I think the clinical rotations are fairly similar going forward. But my first semester, I had one clinical day. So that's an 8-hour shift. And we were at a nursing home. And from what I understand in prior semesters, there's a different kind of variety of settings that you can be in. I had never even set foot in a nursing home before. I was a little unsure of what to expect, but I loved it. It was a great opportunity to practice your health assessment, practice taking vitals, and just get comfortable, taking that first step in and speaking, to your patient, meeting your patient, and helping them. My second semester is med-surg. So that was 2 8-hour days. And I was placed at Concord Hospital. Other students were placed at St. Joe's, Elliott. There's a lot of different clinical placements based upon where they live. In that med-surg rotation, there's all different floors that we were placed on. I was on an oncology hematology floor. So that's a typical med-surg floor. So you have patients coming, post-surgery or waiting surgery, or they have complications. In your third semester was my favorite. It was maternity, which is what I want to do. So the semester is split. You do half maternity and then half pediatrics. And then you also had 4 rotations in mental health. And each of those were a 12-hour shift. And that was 1 day a week. Now in the fourth semester is a little bit different. There's some options, which is amazing. You can be in a group setting. So in a group, it's usually only 4 students in the group your fourth semester with your preceptor, and it's 1 12-hour shift per week. You also have the option to be in a preceptorship. So you're working 1-to-1 with a nurse and you're following their shift. So it's a really unique opportunity to create your own shift or your own shifts. You need to have 135 clinical hours. So however you wish to do that. I know some students in my program are really front loading things. So they're going to be done like in the next few weeks for the entire semester because they've done all their hours before. And then some people are just choosing to do 1 a week and spread it out so they're not kind of overwhelmed. But there is a lot of flexibility. MCPHS does do all those placements for us, which is very helpful. We don't have to worry about anything, finding your own preceptor, trying to find your own placement. You can say like days that aren't good for you or hospitals that you prefer, and they try and match you. So it's been a great experience. There's also a lot of feedback. So you're able to give feedback that's anonymous based on like your preceptor, your hospital, and they take that into consideration to make sure that it's a good fit for students moving forward. So I've loved it. It's been amazing to have such a variety. And that's another reason that I chose MCPHS, because I really wanted to kind of experience everything to really kind of solidify what I want to do post-graduation.
Amazing. Well, you're almost at the finish line.
Almost there.
All right. Well, hopefully, you after today, you'll, want to apply to the program and start the program just like Amy did so that you can start your journey as a nurse. So why don't we move on and talk a little bit more about the application process? So I will turn it over to Christian.
Yes, so as we previously mentioned, we have 2 different start dates. So we have a fall and a spring start date. Spring would be in January and fall would start in September. We are currently accepting applications for spring and fall of 2024. We do welcome you to apply. Applications are being accepted on a rolling basis, so this is the best time to submit an application is as soon as possible for priority consideration. To apply, you complete the nursing CAS application and send all of your required admissions documents to them. We do use a third party for it. The documents that are required are official transcripts from all colleges or universities you've attended. We do require transcript evaluation for any international coursework. We do require a personal statement. So this is recommended to be between 500 and 1,000 words, describing your goals and reasons for pursuing a nursing degree. Students who apply at our Manchester campus will be required to send official high school transcripts if accepted into the program. We don't require the GRE or TEAS exams, so this is not something you would need in order to apply. Next, we'll talk about prerequisites. So there are prerequisite courses that are required for the post-bac BSN program. You can apply with a couple of these courses still outstanding. So you don't need to have all of them completed. You do have to have them completed by the start of class, but you can apply and gain acceptance before completing all of them. Prerequisite courses must be completed with a grade of C+ or higher at a regionally accredited college or university. We can also accept CLEP scores of 50 or higher, or AP scores of 4 or 5 to count towards the prerequisite courses. There is a 10-year time limit on math and science courses, so we can't accept anything older than 10 years. If you are interested in taking some of your prerequisite courses through us, we offer several of them through our online professional studies program. Our online prerequisite courses are self-paced, and new students are eligible to receive a 50% reduction in the cost of the prerequisite courses through our school professional studies. And next, Hannah will talk to you a little bit about the application portal.
Perfect. Yeah. So here's an example of what an application portal looks like. This probably won't look like this when you're applying. This is just an example, but when you've applied to the program, you'll be sent some sort of thing to log into. It's like it's a portal that you can log into to keep track of your status on your application once it's ready to be reviewed. So it'll show, whether your application status is complete and under review. If you've been admitted to the program, this is where you'll see your status first. So this portal will definitely become your friend as you are going through the admission process. And then we also, when we're reviewing your application, we will take a look at your prerequisites and we'll create a evaluation sheet for you, so that you can see which prerequisites you've completed, which ones you still need to complete. And when you log into your portal, you'll be able to click on a link that will bring you to that evaluation so that you can see which ones you still need to get done. And then if you are accepted to the program, the next step would be to submit an enrollment deposit in order to hold your seat in the class. And so in this portal, this is actually where you'll be able to submit your enrollment deposit to hold your seat. And then any contact information would be listed here as well too. So our admission office contact information and student financial services, all that you'll be able to find on this portal as well too. So again, this will definitely become your friend as you move along in the application process. And then I know we briefly touched on this at the beginning of the presentation, but we do have on-campus housing at our Boston and Worcester campuses. So if you are planning to apply to one of those campuses and you want to live on campus, we do have housing available. It is, on a space available basis, so it is somewhat limited, but feel free to go ahead and be considered for housing if you want to through our residence life. And there's different types of housing, everything from studios to suites to condos. So whatever you're looking for in terms of housing, we may have an option for you. And if you go onto our website, you can actually see the different prices depending on the type of unit you want to live in. And then if you're utilizing financial aid, sometimes you're able to use that towards housing, which is nice. And then we also have parking on campus as well. So parking is available across all of our campuses. It is somewhat limited sometimes at some of our campuses just due to space. But feel free to go ahead and apply for parking, and we'll definitely notify you of a space that you have available. And if you do you have parking? You'll get a parking pass whenever you are coming in for your first day of school. All right, and then we have financial aid that is available. So I will let Ro talk a little bit more about that.
All right, everybody loves financial aid. So all candidates are considered for a merit scholarship as soon as you apply. There's nothing extra you need to do, no additional paperwork or no additional online thing. You're immediately considered for a merit scholarship. And domestic students with a FAFSA on file are also be considered for financial aid. If you plan on applying for the fall, we encourage that you fill out your FAFSA by March 15th. And if you are applying for the spring start, November 1st. I got tongue-tied there. November 1st is the date if you want to apply for the spring start. FAFSA is at studentaid.gov. If you have a FAFSA open, you can add our school by our code, which is 002165. And if you have any questions about financial aid or figuring out a payment plan, funding the program for you to attend, our Student Financial Services Department is always there as a resource for you to reach out and talk to them. I think was it 2022, the FAFSA Simplification Act was passed. So there's things changing and flipping around for the 2024-2025 academic year. So I know a lot of students are going to have questions about what's going on with that and how that affects them. So of course, feel free to reach out to our SFS department. They'll be happy to answer every single question you have about that.
Great, perfect. So that does it for our presentation today. Here up on the screen, I've put our contact information. So depending on which campus you're looking to apply for, feel free to take our contact info down and we'll be happy to address any questions. We'll be excited to work with you through the application process as well. So feel free to reach out with any questions. Don't feel like you're a bother at all. And then if you are interested in coming to campus at all, we do have campus tours available. We actually have a couple upcoming events at our Worcester and Manchester campuses. We have fall receptions. So our Manchester one is going to be taking place actually next Thursday, and the Worcester one is the following Thursday. And they're going to be from 5:30 to 7:30, and it's a great way just to kind of see the campus, learn more about the program, and actually meet faculty in the program too. So if you are available and interested, we welcome you to register. Just go to mcphs.edu/visit. And then we also have YouTube videos available as well about MCPHS and programs. So we welcome you to watch those if you're interested as well. All right, so why don't we move on? It looks like there was actually a couple questions that came into the chat when we were talking. So let's address those. So this one is for Amy. So it says, where were you able to work while you were doing this course? Because I know it is so intensive. Or I know it's an intensive program, sorry.
It is. It is very rigorous. It obviously is very doable as well. And I know the question of work does come up frequently. I know a lot of people in my program started out working. I think it's really feasible in the first semester because you just have that 1 8-hour clinical. You typically do have 2 days of class per week. And then you do have lab. So in your first semester, you'll have lab every week. And then throughout the subsequent semesters, it's anywhere from like 6 to 10 times that you'll have lab. And that's because that lab is actually factored into your total course credit load as well. So I think it is feasible in the beginning. I have still worked a little bit, but very little. I would say it is a very rigorous program and really does need as much attention as you can give it. I think staying on top of things and not getting behind it all is really like my best piece of advice. Don't try and cram. There's way too much information. And you really have to have a really good kind of breadth of knowledge. It's not, kind of like cramming the night before the exam. So I guess a long-winded answer, but the short of it is feasible in the beginning. And maybe something like, I know a lot of people are still like LNAs, maybe something like per diem toward the end that maybe you could work like one weekend day. But try and have this program be your primary focus, just so you can succeed. It's 16 months, which is short and long at the same time. But if you cannot work that much, that's what in my experience, that's what I would personally recommend. That was
Perfect.
long, sorry.
That was a good answer.
It's a tough question. It's a tough question, but yeah, I would make school your primary focus.
And that kind of goes along with the next question. It's what is your class schedule like? For example, how many classes are taken a semester? Are they day or evening classes? How many days do you attend class in a week? And how many days are clinicals held?
Sure. So I can kind of go semester by semester if that works. And, if people want to ask more questions as well, I'm happy to answer them. So your first semester, you have 2 days of class and 1 day of clinical and 1 day of lab. So that's 4 days. The classes are all held during the day throughout the program. They're only during the daytime hours. And the clinicals can be on the weekends. So first semester, I had a clinical actually 2 p.m. to 10 p.m. on Saturdays, which seemed a little odd, but I actually loved it. It actually worked out really well. And those clinical placements are dependent upon the preceptor availability. So it may vary semester to semester. So first semester, 2 days of class, 1 day of lab, and 1 day of clinical. And like Hannah said, you do start out right away, pretty much. For that first semester, ours started, I think, the second week of October. So you do have about a month and a half to kind of get your feet wet, get into, being back in school. For some of us, like I finished grad school in 2010, so I'd been out of school a while. So it was nice to have that time to kind of reacclimate to, full-time school, being a full-time student again. Second semester, it's very similar, 2 days of class. 1 day of lab, but not every week. And then I did have the 2 days of clinical. So 2 8-hour shifts, which for me were Thursday and Saturday. Going into third semester, 2 days of class, a day of clinical, and a day of lab. And then fourth semester, 2 days of class, a day of clinical, and a day of lab. So this semester, we only have 6 labs. So it's only 6 days that you have to come in. And then the classes also aren't full day. So for example, this semester, Wednesday, I have 2 classes, so 8:30 to 3:15, and then Friday, 8:30 to 12:45. So each semester you'll have 4 classes. But 3 out of the 4 semesters, one of those classes is a 1-credit class and it's online and it's asynchronous. So there is a lot of kind of flexibility with the program. It does sound like a lot, and it is. However, I will say that the faculty is amazing. They truly, truly want you to succeed, and they offer a lot of opportunity for you to do so, answering additional questions, meeting even outside of office hours. I know a lot of our professors have actually emailed because a student has emailed asking a question and they thought, if this student's questioning it, maybe everybody else is. So they've even taken the time in class or sent out a separate email trying to kind of bridge that gap that there may be within that cohort. So it is definitely feasible. And like I said, lab outside of that first semester isn't every week. So hope that helped. It's long-winded, but expect 2 days of class every week, a day of clinical, a day of lab.
Amazing. Love it. Thank you, Amy.
Of course.
Then we have another question. Is the 16-month program accredited by CCNE? So yes, it is accredited by CCNE. All right, so those were the questions that we had. Does anyone else have any other questions that they want to ask? We will definitely stick around for a couple minutes, see if anyone has questions. All right, let's see. So what is the passing grade for a nursing course? From my understanding, correct me if I'm wrong, Amy, it's a 2.7 or higher. So C plus.
Yeah, so you do have to have a 78 or higher. I know that there is some sort of remediation that they have started. I think it's just for one course. But yeah, it is a 78 or higher. And again, I will say, I know that there's been some students in my cohort that have struggled and that were kind of like teetering on that. And the faculty met with them repeatedly. You know, there's tutoring as well that you mentioned. There's peer tutoring, and there's also a professional tutor that's actually a nurse out in current practice that meets with students as well, that's set up by case. Yeah.
Perfect. And then another question, is there a minimum GPA for admission? So the minimum for admission is a 2.7 or higher. So similar to what you need when you're in the nursing program. And you also need a C plus or higher on your prerequisites as well too. Those are some good questions. All right, any other questions that you may have? It's a quiet group tonight. Amy, I guess I'll turn it over to you and ask you some questions. So main one I always get from students is, why should I choose MCPHS versus another school? There's so many nursing schools out there. Why MCPHS specifically?
Mm-hmm. That's a good question. I know when I was looking for schools, I looked at a few. I went, my undergrad and grad was at Northeastern. They have a similar program, as does a lot of other schools. But I think what really drew me to MCPHS was my interaction with Hannah. She was amazing and led me through the whole process. But also I toured the campus, and I would really recommend a campus tour. I usually help with the campus tours, so you'll get to meet me and ask me all the questions that maybe you didn't want to tonight. But I think the campus tour is a really great opportunity to kind of see where you're going to be. It's not an online program, it's an in-person. So to kind of see the campus, look at the classrooms, and see the labs, like the simulation lab, like I said, is really, especially comparatively to other universities, it's really kind of top of the class. It was really kind of blew me away. I'm on the Manchester campus, which is smaller. I really like the sense of community there. I liked kind of walking class to class and seeing faculty and kind of catching up with them and having them so accessible. That was really important to me. I also wanted to just kind of visualize where I was going to be driving every day and what the campus looked like and what it was near and what the parking situation was, and kind of all those questions that you can't really, see or understand until you view the campus. I think the other part of the program is the variety of clinical placements is huge. Not only are you gaining great experience, but you're making connections. I mean, I'm still, I think I said 51 days from being done. And I've made connections that I already have, interviews set up for, and I don't even have my degree or a license yet. So I think that really speaks volume to the opportunities that's offered at MCPHS. Pretty much all of us are adult learners, some on our, second, third, fourth degrees. So it's really important where we spend our time and where we spend our money. And I feel like MCPHS was the best value for me. So much so that I'm hoping to bridge eventually into the FNP program. So I think that says a lot if I'm, still want to continue for my fourth degree at MCPHS. And I know there was something else I was going to touch on about the university that I just was thinking of with the clinical placements, but I think there's a tremendous opportunity, and just the faculty, the faculty really make it. Having professors that truly want to see you succeed, ask about what's going on in clinical, and then that, kind of like the continuity between the didactic and clinical is really, really important. You're making those connections, you're learning about processes and intervention, and then you're actually doing them in clinical. And I know, like, the type of learner I am, I learn a lot by doing and kind of that hands-on experience. And that is what I think is seen in this program. That's an in-person program in nature. And then just also that continuity is really important. So I've been very, very happy. So obviously I'm here talking about it, but yeah, it's been a tremendous experience. So.
Oh, yes, we are definitely excited to hopefully see your application for the FNP program eventually. So we actually did get a couple questions while you're talking. So one of them was about the GPA again. So what about if you have a master's degree and a bachelor's degree, what GPA do they consider? So again, it's a 2.7 or higher for admission. So that is standard across the board, no matter, what background you do hold. Let's see, link to register for the nursing program. Ro, do you want to add the link in the chat? For us, you can put in the link to the nursing CAS application.
Oh, yeah, give me 1 second.
Thank you. It should just be nursingcast.org if I'm not mistaken, but Ro will definitely put that in there for you, Muna. All right, any other questions? And I think Ro just put it in the chat. Yes. Ro, the only thing you'll want to do is just change it to be everyone, because I think right now only the hosts and panelists of the Zoom can see it. So you'll just
Oh,
want
I'm sorry.
that's okay.
Did not realize. There you go.
Oh, perfect. Thank you. So someone was asking a clarifying question about the GPA. So what GPA do you take between both degrees? So great question. So we will factor in all of your courses that you've taken. So if you have 2 degrees, we will factor in all of those courses. So we'll take, your GPA from one school and then the GPA from the other and combine it together into one GPA. The other thing I wanted to add too is that our admission office does offer appointments. So if you wanted to schedule a phone or Zoom appointment with us, for us to take a look at your transcripts before you apply, just to kind of see where you stand with those prerequisite courses, we're more than happy to do that. You can send us, a copy of your unofficial transcript, and we can certainly go through those prerequisites during your appointment. I know some students like that because they're unsure, whether some of their courses will count or whether some of their courses, meet our time limit. So if you want to, feel free to schedule an appointment with us. You can view our appointment links just right on the website. If you just go to mcphs.edu/visit, you can also schedule an appointment from there as well. Or of course, feel free to email us or call us. Again, our contact information is here up on the screen. All right, so we'll just give it like maybe 1 or 2 more minutes, see if anyone has any other questions, but otherwise we'll definitely let you on your way for the rest of the evening. Yeah, feel free to fire away any questions. And again, we do appreciate you being here. I know it's a Thursday night. So thanks for being here and learning. We hope that you did learn a lot about our program. I know Amy shared a lot of good information from her point of view too. It's always good to hear from a student because their students are in the program. They are feeling it. They are working it. So yeah, we appreciate all the insight that Amy has provided, and hopefully you do too. So it looks like we're drying up on questions. So I won't keep you here for any longer. You probably are sick of hearing my voice anyways. So again, thanks for coming tonight. Hopefully, again, you learned a lot about our program. We hope to see an application from you. Again, if you want to take a look at any prerequisites before you apply, feel free to schedule an appointment with us. We're more than happy to meet with you and see where you stand. But otherwise, enjoy the rest of your evening. If by chance you had to pop out of here during the session at all, feel free to just email us. We're happy to send you the recording from today's session. All right. Well, thanks again, and we'll talk to you again soon. Take care. Thanks, Amy.
Bye, everyone. Thank you.
Bye, Christian.